It's so working. So I hand it over to you, Encik Syed, to say a few words. Go ahead.
Assalamualaikum. Good morning, everybody. My name is Syed Johari. Well, I'm here. I could only talk about my what I'm going through, the challenges, in everyday life, and also how I've been diagnosed and when I was diagnosed. Well, I was coughing a few months in mid 2017 after I'm coming back from UK. I've been having hard, dry coughs, and it ended up until shortness of breath. So, fortunately, my wife was working with the private hospital. So she says, "Why don't we go and see the doctor there?" So we went. I had a shortness of breath, and what they gave me was a gas. That's a normal one. But the MO there, since he knows my wife or what, they go a little bit further, and he hears a creeping sound on my back. And that referred me to the, what do you call that, chest doctor? Pulmonologist, yeah. So she admitted me there. She gave me 5 days of antibiotics. It still doesn't go. The cough is still there. I could hardly talk, not like now. I could hardly talk then. So, and then she, at the same time, she did the scan. And there she found what is called white spots or what on the scan. But, and then I was paying at that time for those medical bills by insurance, okay? But it was running out. So I told her, why don't you refer me to the UMMC, University Malaya Medical Center? And there she referred me to Professor Dr. Liam. I think at that time was the president of the Lungs Society of Malaysia, is it? Yeah. And then he did some tests and asked a 6-minute walk and all that. And then he finally, from the day I went to the private hospital to the day I see Prof. Liam was about 4 months. It takes 4 months. And then Prof. Liam suggested that I do a biopsy to be sure what is it about. So I did the biopsy, and I was diagnosed the IPF, idiopathic pulmonary fibrosis. And that was about 6 months after I started. And then Prof. Liam says, fortunately, we have medicine for this, to treat this. Before they just give you Montelukast and Loratadine. But at that time, Perfimidone was not in this country. It hasn't came in. So Prof. Liam has to ask for an AP from the Drugs Control Jabatan Pharmacy to get the drugs in. And that takes another 3 months. And I was fortunate enough, I got the money to buy. And this is very expensive, as you know. I took it for 1 year. After taking the Perfimidone, before taking Perfimidone, when I cough, I nearly black out. Every time I cough, I would, and sometimes I passed out. It's that bad, the oxygen level. So I managed to buy the Perfimidone. At that time, it was not Asbrit. Asbrit was not in yet. Roche was not in yet. He bought it from Japan or China. It was called Ituari, I think, something like that. So I took 18 capsules a day. That means 6 capsules 3 times a day. Because 1 capsule is about 100 mg, I think. Now with Asbrit, it's about 2 something, 267. Yeah. So I've taken it for 1 year. I'm running out of money to buy. So I told Prof. Liam, and coincidentally, my daughter is a pharmacist in the clinic Kesihatan. She told me to get Prof. Liam to refer me to IPR. We do not know about IPR because IPR to us was TB hospital, tuberculosis hospital before. We didn't even know it's an institute of respiratory at that time. So Prof. Liam referred me to, as many of the Dr. Shakirin's patients referred her as an angel to the hospital. So referred me to Dr. Shakirin, and I told Dr. Shakirin, and she was very helpful for me to get the medicine. At that time, Esbrit was in, but I was a lot of things she did, but I was not eligible, by the way. And then after finally, what I do not know what she did. She was trying hard for it, and I finally got the perfumidon. And that was after I stopped at UMC. It's about 5 months after that. I stopped the perfumidon, and I got to IPR. 5 months I did it. So, then until now, I'm still getting the perfumidon. But my challenges every day was beginning to be quite difficult. Before, I did not have any chest pain. Now, every time I cough, I have chest pain. And then, as I told Dr. Shakirin this morning, suddenly I had a little bit of anxiety, getting cooped up, in a bottle that I cannot get out of because I talk less now. I couldn't socialize now, and I'm, because of this condition, I do not have anybody to talk to except for my wife. And thank goodness she's there, and still coping up with it. Hopefully, I told Dr. Shakirin, I would be in the clinical trial. Give me anything, I'll take it. That's it. Thank you very much.